Welcome to the first Great NHS Heist podcast. My name's Sarah Gangoli and I'm a returning NHS Doctor.
I'm Dr Bob Gill. I'm a GP and also an NHS campaigner.
The news is a wash of news about COVID-19, about how countries are dealing with it and about how this is ravaging the human population. So we thought it'd be useful for you to understand why we're taking a different approach and why perhaps you should listen to us. Very few people are talking about this crisis in its proper context, in the context of a healthcare system weakened through decades of fragmentation, betrayal and propaganda, in the context of 10 years of austerity with a weakened population, sick with the diseases of despair, a social care system which is not fit for purpose. This is a society which is based on the needs of financiers and their wealthy clients. But we now have a situation where the needs of the many and the suffering of the many is being brought into sharp focus.
My main reason for doing a podcast is to provide more of a context and also a perspective from the front line. I'm a GP and I have been for the best part of 20 years, and I've been seeing how the NHS has been set up to fail and made more precarious over the years, and we need to understand the current pandemic, the current crisis in the context of what's happened to the NHS. So that's why I think it's important, and so far I haven't really heard too much of that context being put across on the news, and certainly the corporate media hasn't really given this background, which I think is vital.
No, I agree, and I think we should really start by setting the scene, discussing why our healthcare system is in the state that it's in while we face this crisis. And we can't really do that without going back about 40 years in history to the election of Margaret Thatcher in 1979. Now, in her first term, she turned her attention to privatising things like council housing, so introducing corporatisation into the public sector. And it was towards the end of her first term, going into her second term, that she started to outsource non-clinical services, catering, cleaning, portering, all of these which we now know are vehicles towards privatisation. Later, she was to introduce further legislation, and if we fast forward, we can see that this led to the major government starting the Private Finance Initiative, which was given somewhat of a large injection under Blair, with the massive expansion of the Private Finance Initiative. During the Blair years, we also see the establishment of foundation trusts, the Unsustainable Providers Act, which allowed these separate business entities to actually go bankrupt. Again, fast forwarding to the coalition years, the 2012 Health and Social Care Act was an act of dismantling the NHS. For the first time, the Secretary of State for Health did not have responsibility to provide universal health care to the population. Instead, that was devolved to a quango, NHS England. Through this, we saw the establishment of separate insurance pools called clinical commissioning groups. And also we saw the decimation of public health funding through reduction in funding. Again, this was devolved to a quango, Public Health England, and we saw massive reductions in spending in public health. And I think we're seeing the consequences of that now.
So yes, so it's because of this long trajectory and the lack of coverage it receives in the media that, I felt it important to become active and campaign for the NHS. I first got involved. I first became aware of the extent to which the NHS was under threat in 2012 after closures of my local hospital, and I got involved in the Save Lewisham Hospital campaign, and it was through that I decided with a group of other largely doctors to make a film, which we made in 2014 called Sell Off. But more recently, I produced another film called The Great NHS Heist, which can be found on YouTube and also Vimeo. And what it sums up is how the NHS has been carved up and set up for complete corporate capture. There is no way of disguising that this is the trajectory, yet most of the profession and most of the public remain unaware. And part of that setting up the NHS has involved the decimation and disruption of established public health systems, which have led the NHS to be vastly underprepared and certainly having not enough capacity to meet the challenges of the pandemic without significant emergency reorganisation and shutting down of routine services.
In fact, we talk about privatisation by stealth, but actually their intentions were fairly explicit. When you look at key documents such as The Health of Nations published by the Adam Smith Institute, or the book Direct Democracy, which notably the former Secretary of State for Health Jeremy Hunt contributed to, we actually see that their intentions to privatise the healthcare system and bring it more in line with an American-style HMO model, or Health Maintenance Organisation model, these intentions were quite explicit. So we've moved from a situation where their privatisation by stealth has become so obvious that it's now overt.
The key documents you talk about, you list there, unfortunately general public awareness is next to zero, and certainly that's not helped by our media. But if we bring people up to the current situation, and how do we find ourselves as the NHS currently trying to manage with the COVID epidemic? So what are the key things that have really shown up the NHS for not being ready to deal with the current challenge?
Well, I think we can look at examples around the world of how other countries have handled this. Now, this virus, the first documented outbreak was in China. And we have an interesting clip to play you about how they actually handled that initial outbreak.
So what you're about to hear is a clip from an interview done on MSNBC with a New York Times health correspondent.
China has had enormous success in beating down its epidemic. We don't know what's going to happen when China tries to reopen its economy and let people go back to the factories and back to the subways and back to offices and restaurants and everything else. We don't know what's going to happen, and they're going to do it in a very slow, graduated way, but they have been in lockdown all this time. But we see the drone shots from these cities and we think, ooh, lockdown, it looks terrible, there's no traffic on the street. That's not the point of what they did. They had to do that in order to introduce the measures they were going to take that were actually going to fight the epidemic, and that is testing, find the virus. So one thing is, no matter where you go, if you are able to get out of the house in there, if you go into any building, your temperature is taken. I came into this building, nobody took my temperature. They asked me some silly questions I could have lied about. But, you get your fever taken. You get into a bus, your temperature is taken. You walk into the train station, your temperature is taken. You walk into the building, you walk back to your apartment building, your temperature is taken.
And what happens if you show a fever?
Then you're sent to a fever clinic. People are not sent to their own doctor's offices. Your doctor's office is dangerous. One of those tests will make you cough, usually cough or gag, and then you've infected the doctor. And then the doctor's office is out, and you've possibly infected everybody else in the waiting room. So they are sent to specific fever clinics, which the Chinese have had since they battled SARS back in 2002. They designed these and basically mothballed them. It's usually an entrance to a hospital. It's separate from the main entrance. They're met by people in complete protective gear. The temperature is taken. They're asked quickly what their symptoms are, whether they've been exposed, how they've been exposed. They get a quick white blood cell count, which takes about half an hour to see whether or not they have bacterial pneumonia. It doesn't tell you what the bacteria is, but it tells you whether or not you've likely got that. They get a quick flu test to see if they have flu. If you've got one of those, maybe you can be excluded and go home. You're something else. But if you don't have either one of those, then you're given a CT scan. CT scans in this country take half an hour to an hour, and they're extremely expensive things. There they have portable CT scanners. They have pushed people through those things at the rate of 200 a day. Couple of slices of the lungs, and that's all, to see whether or not there are these ground glass opacities in both lungs that are a pretty good indication of this. All right, if you come up positive for that, then you are going to get a PCR test, which is the test we're talking about here. Mm-hmm. It's basically a nasal swab is the usual way to do it, which is push a Q-tip up your nose so far it feels like it's going into your brain. It's not very pleasant, but then they do that on site. they've gotten it down to 4 hours. There's no sending it off to the state health department.
So you
no.
sit and wait for it to come back.
And you sit and wait. You are told, sit, a couple of yards apart from everybody else. People are sitting there, it was described to me, they're sitting there with their pink envelopes with their CT scans inside them, and they're afraid of each other because they all know that they might be, they might be sitting next to somebody who's got the virus. And once the scan results come back, and if they can't get the scan results back that day, they have to go to a hotel, a quarantine hotel, and wait until the results come back.
Apart from their family.
Apart from their family. And that is the key element. There is no home isolation. There is no home quarantine. 75 to 80% of the transmission in China was in family clusters. What would make the news was things like, oh my God, it's in the prisons. Oh my God, it's in Parliament, or whatever. It wasn't in Parliament there, but you'd hear these kind of, but 75 to 80% of it was inside the family. And they knew they had to stop that if they were going to stop the disease. So people were literally quickly taken away from their families to these giant gymnasiums or stadiums where they were not concentration camps. They were beds, there, and there were nurses in protective gear to watch out for people. They even had dance classes in these things. Because when you have lots of little old ladies sort of sitting there together waiting to see if they're okay, if you get them all up dancing, one, it helps clear their lungs if they have pneumonia, and the people who can't get up may be the ones who are crashing. It's not a bad policy. We laugh at the pictures when you see people dancing in what look like moon suits, but in fact, that was something medically smart that was going on.
So what we've heard is very impressive in terms of what China had managed to achieve. Admittedly, there was some delay in them notifying the world that there was human-to-human spread of this virus. But once that became accepted and declared to the rest of the country, rest of the world, then they got into action and they were turning round suspected cases of COVID-19 within 4 hours. Those that were found to be negative were sent home. Those found to be positive underwent strict quarantining and contact tracing. Now we are 3 months down the line and we do not have anything close to approaching what China had done very early on. Sarah, how would you contrast our performance?
Well, I think it's important to point out that it's not just China, that Taiwan, Vietnam, South Korea, even closer to home, if we look at how Germany has been extremely efficient in testing, contact tracing. Ireland, Portugal again, with much lower death rates than us. And I think the contrast in approach is unfortunately counted in the number of people who have died from this virus. We can compare ourselves to other countries, which is not necessarily helpful when it comes to death rate. For example, if we look at Italy, Italy was the first country to have a major outbreak in Europe. I think they were caught unawares. It's probable that no other European countries were actually significantly prepared at that stage. They also have an aged population. But we have no excuse whatsoever. There was an article in the Sunday Times, I believe that was last weekend, which said that there was a period of 5 weeks when nothing happened, when our Prime Minister didn't even attend COBRA meetings to discuss this crisis. And this is after the WHO had declared this a global emergency.
So by the end of January, it was clear to public health experts in this country that we needed to ratchet up our response. Then there followed this 5 weeks hiatus, but there were also public statements by Boris Johnson, which filled me with dread. He went on to Good Morning Britain and talked about how the population should take this on the chin. And I felt physically unwell when I heard that response. And then we had the delay in cancelling public events. So we had the Cheltenham Festival, which went ahead. We had Atletico Madrid playing a match in Liverpool, which went ahead. Now, it took sporting events and the Premiership to take their own decision about cancelling the Premiership League. It was not down to government being responsible and taking appropriate action. So even when the piecemeal lockdown started to occur, it was not due to our government. The government failed to do the right thing. And no doubt this has had a devastating effect in terms of the spread of the virus across the country.
There was also the initial, now denied, strategy of herd immunity. And this has been extremely damaging in several ways. Firstly, it is a catastrophically dangerous strategy when you're dealing with an unknown quantity and a virus with a high mortality rate. I think that anybody with any knowledge of what herd immunity is in the context of a vaccination program, for example, which is very controlled, would say that. But it's also given mixed messages to the public. So you still have people who are very confused about what is the best approach to take. So the messaging has been very, very confused. Now, coming back to the herd immunity strategy, which the government now denies was ever their strategy, even though it's quite plainly on record, there have been suggestions, and this again has been denied by Number 10, that this was promoted and pushed by Dominic Cummings. Dominic Cummings, who is firstly unelected, and secondly, as far as I am aware, has no scientific background whatsoever. He has been influenced by people from America. Apparently he's a great admirer of an evolutionary economy proponent called Epstein, who belongs to the Hoover Institute. Interestingly, Margaret Thatcher was an honorary fellow of the Hoover Institute.
So this was a right-wing think tank?
This is a right-wing think tank.
Yeah.
And they have been pushing this idea of herd immunity. In fact, they released some really ascientific and erroneous reports that humans were starting to adapt to COVID-19 within 4 weeks. Now, anybody who knows anything about evolution will realise that these things happen over centuries, millennia, not over 4 weeks. So it was a really, really dangerous strategy based on absolutely no scientific understanding whatsoever, and it has created mass confusion and has been extremely damaging in the fight against this virus.
But if you look in the context of, we've had austerity since 2010, we've had the Health and Social Care Act, which is a privatisation act, and we've seen the impact of these things in terms of, one study estimated 120,000 people died as a result of austerity, cuts to health and social care. Another study showed that infant mortality, that is children surviving after birth, that has declined for 3 consecutive years in a row. And we've also had the slowing down of the normal increase in life expectancy that's occurred in equivalent economies across the world. But in the UK, this slowed down and then started to drop. So there are 3 separate pieces of evidence that show that the government has been pursuing policies which are putting lives at risk. Now, it doesn't surprise me that their first concern for the pandemic we're currently in the middle of was economic rather than humanitarian. They took a decision from what they were hearing that this predominantly affected the elderly. And I think if you're coming from a right-wing perspective, these are people who are no longer important. They're no longer economically active. They are not contributing to the GDP. And we have to face the fact that our government policy and the way we handled our response to this pandemic was based on finance rather than saving lives.
I think it's really important that you call this a decision, because it is a decision. It's very easy to write these people off as incompetent. But when we understand that they have known about, for example, the effects of inequality since 1980 on various health indices, but also in 2016, there was a report called the Cygnus Report, which looked at the UK's preparedness in the face of a global pandemic. And it found that not only could the UK not cope with the number of deaths associated with a global pandemic, but that the intensive care capacity would be overwhelmed and that healthcare workers would not be appropriately protected. Now, rather than act upon that and increase our preparedness, our government took a decision not to invest, not to listen to the content of that report and actually focus on other things.
and they're also determined not to make that report public. So there have been various requests to see what was in the report. We know the person in charge of the NHS at the time, the Secretary of State, was Jeremy Hunt, and policy at the time was to shrink the NHS. One of the effects of the 2012 Healthcare Act was to decimate public health, and what that means is to dissolve those established local public health infrastructure and to centralise it into a new quango called Public Health England, thereby breaking the existing micro-environment of public health that had served the test of time. Now, a lot of that had been got rid of. Also, the importance of public health was diminished and absorbed into local councils. And no longer did you need to have a medical background to be a director of public health. So there are certain systemic decisions that were taken that drastically weakened public health and the voice that public health should have, particularly as we're realising what we're in the middle of at the moment.
Yes, the provision of good, standardised public health care is enormously important in preparing a country for a global pandemic, but also coordinating the response and liaising with international bodies. And I think it's also important to note that since austerity, local government funding has also been slashed. So there's been a double attack on public health.
Now let me just reiterate how this should have been done. If you have an infection, what you need to know is who is infected, whether this infection is being passed on to other people. So testing is key, contact tracing is key. This is not something we need to discover afresh for the first time. This has been established practice for over a century. Yet the government completely failed to do this. We had flights coming in, and we still have flights coming in from all over the world, and there is no testing on people on arrival, even if they come from other hotspots like New York. So we're continuing to invite the virus into the community. We are not isolating people who are positive. There are cases whereby elderly people who have been proven to be positive with COVID-19 are sent back home to their nursing home to potentially infect other residents of the nursing home. We also know that the people most at risk, the people exposed to lots of virus concentration, are healthcare workers. Now, it is not rocket science to realise that these workers need to be protected, because otherwise, if they become ill, they are taken out of the workforce. They also potentially could be infecting other patients and infecting their families at home. So the government's inaction and government's decision not to treat this infection with the respect it deserves has inevitably cost thousands of lives, and what is particularly tragic is over 100 health and care workers have already paid with their lives because of government action.
It's a really important point, Bob, and I think another important point which arises from this is there's been a militarisation of the language around the response to this pandemic. So we're in a war. We talk about the front line. We talk about healthcare workers as though they are soldiers who have willingly signed up to put themselves in danger. No, healthcare workers sign up to help other human beings. Many people in this country sign up to be part of something like the NHS. They do not sign up to be put in harm's way by their employers. And in fact, that's actually against the law. Okay, there's legislation to protect people at work, and not providing healthcare workers with appropriate personal protective equipment is in breach of that legislation.
Well, it's a fundamental principle: protect your staff. What is worse, we hear also accounts of doctors and nurses being told to stay off social media. Some have been instructed to remove social media posts when they express concerns about their lack of protection. Other staff have had masks and goggles removed from them, which they've purchased themselves. So not only have they tried to make their own provision, the management within their trust has decided to expose them to greater risk by insisting they stop wearing what they bought for themselves. This is beyond belief, but what we're also seeing in the midst of this turmoil and chaos is how the government is continuing to push forward with its privatisation agenda. And what I want to play now is a clip from Dominic Cummings, where he explains how crisis could be put to good use.
People will say it's impossible to do this, but people told me that lots of things are impossible. People said you'll never beat Blair on the euro. People said you'll never get more than a fraction of your crazy plans through the DFE. Things are possible, and they're particularly possible when crises hit. Monet created the whole EU pretty much on the basis of what you call beneficial crises. And because of the nature of the world and where things are going, I think we're going to be seeing lots of beneficial crises shortly, which will enable us to change things along the lines that I've suggested if we want to. Thank you very much.
What Dominic Cummings was saying there is to use crises that occur to push forward policy which may seem completely unpalatable under other circumstances and might attract more scrutiny and attention. And in terms of the NHS, well, what have we seen? Instead of utilising health and care staff that work for the public sector, the government have set up testing centres which haven't worked very well using an accountancy firm, Deloitte. They have used staff from a commercial company, Boots, who is also a tax dodging corporation which tries to minimise its tax in this country. So we have accountants and tax dodging corporations being brought in on the back of the pandemic. And this fits in with the general trajectory of the privatisation.
Indeed. And the other thing, I think when we're talking about healthcare workers, it's been really, really interesting, hasn't it, that we have the government making a great big show of standing outside Number 10 and having this rapturous round of applause for our, in inverted commas, heroes. Now, it's all very well that, you know, people appreciate the NHS. I think people should appreciate the NHS. I think people should appreciate those who work in the NHS, particularly at this time. But there's a real danger in painting NHS workers or other key workers as heroes. This 2 minutes of applause is a massive cosmetic exercise. And we really have to wonder when that 2 minutes of love is going to turn into an Orwellian 2 minutes of hate. We've already seen that in portions of the right-wing press or the right-wing Twitter sphere, that healthcare workers are being criticised for taking part in this 2 minute show. That healthcare workers are already being criticised for posting themselves dancing. Now, why that may not be my taste, there's no real harm to it. However, I think that healthcare workers have to be really, really careful about this portrayal of themselves as heroes. Not only is it dangerous, not only can it be turned against us, but it's also potentially divisive. Healthcare workers are just ordinary workers. They have an employer, they have rights at work, ideally they have representation. The fact is that healthcare workers are currently being put knowingly in harm's way. And yet this 2 minutes applause is supposed to be some sort of compensation and acknowledgement of this. It's simply not good enough.
But the fact that our politicians who oversaw austerity, oversaw a 15 to 20% real terms cut in the salaries of NHS staff, are cynically exploiting this public sentiment, which I think comes from a good place. But I think you're right to point out that it may very easily be turned round to attack NHS staff, but it also feeds into a very common theme of government, is this divide and rule, setting up essential workers, NHS workers, care workers as separate. But what about the rest of society? Because as the impact of the pandemic really sets in, we are on the verge of a huge economic downturn when perhaps the public sector may even be seen as protected. And there will be potentially an atmosphere brewing which will feed into resentment. So we need to be very careful that we do not provide ammunition for a divide and rule narrative, which I'm sure the right-wing press and government may wish to exploit in the not too distant future.
And some of them already are. And I think that this leads us on to talk about the potential impact of this on how we live, on our society. Many people are going to be bereaved as a result of this virus. Many families are going to be severely affected by this. And obviously with that, there's a penalty in terms of mental ill health throughout the population. Isolation is also a major challenge for people, particularly those who are older or have issues with mobility or communication. But also, there are going to be wider reaching, longer lasting implications for the whole of society. We have seen the passing of really quite draconian legislation under the cover of protecting us all during this pandemic. Now we can have surveillance, warrants, searches without any judicial oversight. And this legislation is to be in place for 2 years, long after the pandemic has abated.
And it's also true that the legislation was ready to go off the shelf. I think this is another example of what Dominic Cummings was referring to as a beneficial crisis. They managed to push through draconian legislation under the cover of acting in the public interest, which I don't believe was the motivation. So if we could just think about how the media is covering the crisis, the parliamentary press briefings that occur on a daily basis, and what is the message that they're getting across, and what are the messages that they're leaving out? Because I'm quite concerned that so much crucial background information and perspective is completely left out.
Well, we hear the figures every day, the fairly grim figures, but they're qualified. They tell us these are hospital deaths. We still don't have figures about the number of people dying in the community or in care homes. And this is a major omission. It also suggests that, on some level, the people delivering these lines, because that's what they are, don't value these people who've died in care homes. And we know that a lot of people are suffering in care homes, and these figures are not being mentioned. But also we have the constant repetition of stay home, protect the NHS, save lives. Now, yes, social isolation is important. Social distancing is important. But we could be left with some major health problems after this, because people have been deterred from presenting when they should present to their doctors or to hospitals. Things which they wouldn't have ignored before, they're either ignoring or delaying. Mental health problems are being left to a large extent. And we could see some very, very significant impacts on health when all of this has died down.
Yeah, I think the very easy slogans that they've come up with have had negative impact in terms of confusing people when they should seek help. They needed to be much clearer about that. We're also seeing delays in diagnosing cancer. We're also having impact on people waiting for treatments, vital treatment, life-saving surgery, life-prolonging chemotherapy. These have all been put on hold, and that will have an impact on people dying preventably and earlier than they would have done in months or weeks ahead. So it's not just the numbers of those dying with COVID, but the undiagnosed patients and the sort of almost second-class citizens who are dying in the community, which I believe the Financial Times estimated that approximately double the number of deaths have occurred in the UK, approaching 40,000, not just under 20,000, as is rehashed in every press conference that we're hearing.
And in order to come up with those figures, they compared the normal seasonal death rate to what we're experiencing now. And the majority of those deaths are undoubtedly going to be due to COVID-19. A smaller proportion are possibly going to be due to people not presenting with chest pain, with symptoms of a stroke, etc.
I think it's very important for people not just to rely what they're hearing on the BBC and ITV, because the messaging from them is toning down the impact of this crisis. They're presenting figures as if they're on their way down, but we're not getting real-time, reliable statistics. And they're also giving over to stories which might not get the point across in terms of what the public need to know, and what I'm referring to is how the government have dangerously and in a very deadly way mismanaged this whole crisis and continue to do. So we're weeks down the line, and only now do we have the proposal of testing. And I understand today they've released some tests available, but within minutes the capacity was exhausted. So this is an embarrassing series of mismanagement and ongoing subjecting the public to risk because we haven't got on top of the basics, and the basics come back to test, test, test.
And they are the fateful words of the WHO some months ago, actually, was test, 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 and this has been ignored by us. I think it's also worth pointing out the situation in America at the moment. Now, they've got a president who recently suggested injecting patients with disinfectant to deal with this virus. I mean, it's almost beyond belief, the kinds of things which he is continuing to say. But also, this is a country that does not have universal healthcare provision. We've seen that in New York, they became overwhelmed very, very quickly, and tragically, they had to dig mass burial pits. Really quite a horrific situation in New York. But we have other states which are struggling to provide their staff with PPE. There's been interference from the federal government, particularly relating to those states which don't have Trump-supporting governors. The situation in America is absolutely dire. Our saving grace is the NHS. Our saving grace is that provision of universal healthcare, and that is what is being systematically undermined by this government.
Either side of the Atlantic, they still seem to be holding onto their market ideology rather than doing the right thing, taking control, taking over private sector resources, for example, instructing manufacturing capability to produce what is needed. Instead, we have chaos. We heard recently how the storage facility for PPE, the emergency storage facility, has changed hands 3 times in the recent years. So commercial activity and profiteering seems to be taking precedence over saving life. So to get a more rounded view of what's really going on, people need to look at other sources. For example, to get an overview of what's happening in America, I found Democracy Now! Very useful. It gives a more balanced approach in terms of what's going on there. Byline Times have produced a series of articles covering the coronavirus in more depth and also giving the political perspective and an overview. Professor John Ashton has been very outspoken in terms of the poor response of government and the poor public health measures that have been instituted. So I would advise people to look up these resources and to inform themselves in terms of how we should be doing things compared to how things are really happening in this country.
I think what's been really interesting about Double Down News is that they really have focused on experts giving expert opinions rather than politicians, rather than perpetuating this false equivalency that we have seen over the past few years, where experts' opinions are countered by people who have no relevant background whatsoever. And I would echo Bob and say that Professor John Ashton is definitely somebody we want to be listening to right now.
In terms of the experts the government does quote, we had an almost unbelievable phrase expressed by the Deputy Chief Medical Officer, who said that the UK government's response was an exemplar to other countries. I nearly fell off my chair when I heard that comment. So the experts that they do employ and they do listen to, I'm afraid are probably ideologically aligned and political appointees. They're appointed for their compliance rather than acting in the best interests of the public.
We also have previous holders of, Chief Medical Officer, Chief Scientific Officer, who have countered some of the things that the current appointees have said. And additionally, the previous Chief Scientific Officer said that he was not aware of any time where a Prime Minister was not in the chair at a COBRA meeting. And this again speaks of a level of negligence on the part of Boris Johnson, and willful negligence, that he was not able to attend those COBRA meetings. In fact, it has been suggested that he was so obsessed with riding high after his election victory and with the UK leaving the European Union on the 31st of January that he ignored this issue.
No, that is clear. He has certainly not covered himself with glory. I have seen nothing remotely Churchillian about any of the decisions or actions he's taken. But just to bring it back to a more positive note, what the pandemic has revealed is how vital a well-functioning, well-funded, well-organised health service is to all of us. COVID-19 does not respect class, colour, or your financial background. So we all need universal healthcare. And I think the public have been reminded about the importance of the NHS. We've seen community spirit with local people volunteering, getting together, looking out for their elderly neighbours, looking out for their elderly relatives. This has reminded people of the importance of being human about others around you. And contrary to Margaret Thatcher, there is such a thing as society, and society has pulled things together for us. It's also been a time for people to sit back and reflect on what's important in life, how important it is to maintain relationships within families and friends. And technology has been useful as well in this, because people are using the internet, using Skype, using various methods of communication to maintain contact. In some cases, people have never heard so much from their siblings and children. So there is definitely some benefits and some hope in terms of what we've seen in terms of the public's response to this.
I think it's important to finish with a message of hope, actually, and I think it's important to recognise that people are starting to realise the importance of key workers. These workers who not so long ago were called unskilled by the current Home Secretary are now doing pretty essential work. They keep us all alive, whether they're delivering food, whether they're delivering supplies to hospitals, working in the hospitals themselves, supermarket workers. All of these people are absolutely key workers. And we have, I think, seen that society can come together. I think we have seen a form of egalitarianism imposed by this horrific virus.
So we'll be bringing this podcast to an end. What we hope to do is to have further podcasts. We may try and bring some guests with specific expert knowledge to contribute to what we're saying. And we want to do this to maintain context and inform the public as to what's going on, because without information we will not be equipped to fight to save our NHS. That's the fundamental driving force behind why we're here and why we're wanting to share our experience with you.
So until next time, everyone, please stay safe.
Thank you.
If you want to find out more, if any of this is new to you, please do check out Bob's film. It can be found on the Great NHS Heist.com or Vimeo or YouTube.